Just a minute, sir.
थांब ना गं, Tuesday ना 30 उद्या 29 झाल्यावर करते मी तुझा व्हिडिओ शूट.
Welcome all after the lunch break. अच्छा खाना खाने के बाद ये जो सेशन शुरू हो रहा है वो भी बहुत ही, जैसे तुमने स्वादिष्ट व्यंजन खाया है वैसा ही अभी ये स्वादिष्ट एक सेशन शुरू होने जा रहा है. बेसिक लाइफ सपोर्ट हमारे कॉलेज के प्रोफेसर क्रिया शरीर फर्स्ट ईयर को जो पढ़ाते हैं और जो एचओडी है क्रिया शरीर JAMC के रविराज परदेशी सर. वेलकम सर.
थैंक यू मैम.
कंसल्टेंट इन क्लिनिकल रिसर्च एंड हेल्थ केयर क्वालिटी मैनेजमेंट एट श्री कृष्ण हृदयालय नागपुर. इनके बारे में भी जितना कहा जाए उतना कम है. बहुत सारे डिग्रियां इन्होंने हासिल की है. PhD in Vedic science, master certificate course in Vedic studies, executive PG diploma in healthcare quality management, 6 Sigma green belt in quality health care management, PG diploma in medical law and ethics, of course MD physiology Ayurveda, बैचलर ऑफ आयुर्वेदिक मेडिसिन एंड सर्जरी. ये जो इन्होंने BMS तो किया ही है सर ने. इनके बारे में एक बात मुझे कहनी है कि पिछले साल इनका जो इस विषय पे हुआ था स्पीच, सब अट्रैक्टिव हुए थे इनके स्पीच के तरफ. आज भी वैसा ही होने वाला है. इनका स्पीच शुरू करने के पहले थोड़े जिंदगी के बारे में, क्योंकि सब्जेक्ट ही वैसा है, लाइफ के बारे में। ऐ जिंदगी तेरे जज्बे को सलाम, ऐ जिंदगी तेरे जज्बे को सलाम, पता है कि मंजिल मौत है, फिर भी दौड़े जा रही है। जिंदगी जीने के लिए किसकी जरूरत होती है? आपको सबको मालूम है, ऑफ कोर्स सांसों की। इसी सांसों के बारे में सर आज हमसे बात करने वाले हैं। बहिनाबाई मराठी में बहुत अच्छी कवयित्री है। उन्होंने क्या कहा है सांस के बारे में, श्वास के बारे में? आला श्वास गेला श्वास त्याचा न्यार रे तंतर, अरे जगन मरण एका श्वासाचा अंतर। तो ठीक है, अभी हम विनती करते हैं रविराज परदेशी सर को कि उनका सेशन वो शुरू करें। वेलकम सर, यू कैन
Ma'am,
स्टार्ट।
please allow me to share the screen. You'll have to make me host.
ओके ओके सर।
माझ्या नावासमोर जाऊन तिथे एक मेक होस्ट म्हणून ऑप्शन असेल, त्याला फक्त क्लिक कराल.
सर आई एम नॉट होस्ट ना, मैं बोलती हूँ सर को।
अच्छा, श्रीकांत सर इज होस्ट.
हाँ हाँ, उनको बोलती हूँ सर।
श्रीकांत सर. अच्छा, by that time we will discuss. So how many students are there? 34 is the number I can see. Right? Am I audible to all?
Yes, sir.
Yes, sir.
Yes. Now everybody
Yes,
has
sir.
to unmute himself or herself. You need not put your videos on, but your mic should be on. And don't speak anything in between. You need to answer only those questions which I'll be asking. And be prompt in asking the questions. Asking the questions as well as responding to the questions. Okay. Can you all see the screen now?
Yes, sir.
Yes, sir.
Yes, sir.
What you are seeing on screen, what is the title?
Basic life support.
Right. So you all have taken admission to a medical college, irrespective of whether you'll be practicing Ayurveda or allopathy. You will be seeing the patients, right? And there are chances that you may witness or come across a patient. There is a background noise. हेलो, या फिर अभी आप लोग म्यूट कर लो अपने आप को, जब जरूरत पड़ेगी तब अनम्यूट करना, क्योंकि बहुत सारा बैकग्राउंड नॉइस भी आते रहेगा. राइट. सो व्हेनेवर you will be starting a practice in future, it is possible that you may come across a patient or a relative of a patient who will rush to you and will say, डॉक्टर साहब देखो हमारे पेशेंट की सांस फूल रही है, डॉक्टर साहब देखो हमारा पेशेंट बेहोश हो गया है, डॉक्टर साहब देखो हमारा पेशेंट बात नहीं कर रहा है. एग्री और नॉट?
Yes, yes,
Yes, sir.
Yes, है ना. So there are fairer chances that these type of situation will arise when a patient experiences a cardiac or a respiratory arrest. So I'm using two terms here. One is a cardiac arrest and another is a respiratory arrest. So if we combine both, the term becomes cardiorespiratory arrest. So cardiac stands for heart and respiratory stands for breathing. So when breathing and cardiac activity both ceases, that means patient is dead. Understood?
Yes, sir.
Yes.
yes, sir.
Yes. So whenever we happen to see such patients, and if such patients have become unconscious in front of us when we are in clinic or when we have visited the patient at his or her home, and if we witness that the patient has collapsed in front of you, that means he is or she is giving you an opportunity to resuscitate him or her. So this is one more term which I have used now, resuscitation. The first term which we come across was cardiorespiratory arrest, and second term is a resuscitation. So resuscitation is something which we perform as an attempt to save the life of that patient, right? So to ensure that we provide timely help, and the maneuver like cardiac massage and giving breaths to the patient manually or using AMBU or some sort of device, that is called as a basic life support. So basic life support is a part of a resuscitation. Resuscitation is a wider term. Resuscitation is used in hospital also, like in ICUs, cardiac hospital, tertiary care hospital, right? The patient who has a heart attack has undergone some procedure and develops cardiac arrest there, then there also resuscitation is performed where the patient is intubated, a tube is placed into his lung from where direct oxygen is delivered, and a cardiac massage is given by compressing the chest repeatedly for a particular frequency over a particular time period. So these activity comprise a procedure or a process which is called as a basic life support. So patient can develop cardiac arrest. Arrest means stoppage of activity. Our heart beats how many times in a minute? 72, right? Hannah? So the range is from 60 to 100, right? So if my heart rate goes to 20, will it be able to maintain circulation? No, it will not.
No.
It will not, because my brain will not be supplied with the blood flow and I will fall down. There will be a syncope. Chakkar aake gir jaunga main, right? So this is as good as a cardiac arrest. If I'm not breathing and my heart is pumping, this is also not okay, because what heart pumps? Heart pumps oxygenated blood.
Yes.
If that oxygen is not mixed with that blood, that is of no use, right? So what we want both to be functional, heart and respiration both. But if we do this process of giving a basic life support in a haphazard manner, है ना, like कोई भी आगे कुछ भी कर रहा है, कैसे भी छाती दबा रहे, कैसे भी सांस दे रहे, कैसे भी ब्रीदिंग दे रहे पेशेंट को, तो this will not work, right? So we have to ensure that there is some process, some chronology, some flow, and this process or chronology of observation or deciding the things is called as a chain of survival. And this is different for adult and children. Children may the protocols are different, adult may the protocols are different. So that we will see. The new term which you will have to learn here is a CPR, cardiopulmonary resuscitation. And we have to ensure that the quality of this resuscitation is high. The resuscitation which we are giving is at par with international standard, because there is a continuous research happening in this area. The last year से ज़्यादा इस समय अपने को improve करना है CPR. So what were the flaws? What were the loopholes previously which can be overcome now? So new research strategies are applied, new experiments are done, and it is seen that with advancement and with newer modifications, the outcomes are improved. Outcomes means अगर 10 पेशेंट को अरेस्ट होता है और 10 के 10 को हम लोग सीपीआर देते हैं, तो देयर आर फेयर चांसेस कि हम लोग 5-6 लोगों को बचा लेंगे. This means that if we have not gone for giving CPR to all those 10 patients, they all those 10 would have died. Correct?
Yes, sir.
Yes. So what do you think? By giving CPR, we can save life. Definitely, we can save life. Right? Another term is rescue breath. Rescue means something which is done to save a life. These breaths which we are delivering to a patient, either those breaths will be delivered by doing mouth-to-mouth respiration or by using some sort of a device which is called as a bag mask device. I'll show you how that looks like. And delivering breaths to a patient is called as a giving rescue breaths to a patient. Then there is algorithm. Algorithm means flow. What has to be done after what? What should be the first step, second step, third step, and so on. And one more component which is used in the hospitals only is a use of a defibrillator. Defibrillator is an electrical device which is used in a patient who has fibrillation. Ventricles, they contract with a speed of 70 contractions per minute, but if ventricles start contracting with 200 beats per minute, 300 beats per minute, so they will keep on contracting, but will they empty the blood? Will they push the blood out? No, because they are only contracting. So there is no time for them to get the blood filled in their cavity. Even if they are in a phase of diastole, but that diastolic phase is having so little time that there is no enough time for that left ventricle to get filled with the blood. So if there is no blood, there will be no pumping out. No pumping out means no circulation to the vital organs. So in that situation, we have to use that defibrillator. Now it is possible that you are alone there when the patient develops arrest, or you may have someone to accompany you. So in that situation, the response and the pattern will vary, and we will see how that varies. Basic life support is a level of a medical care which is used for victims of life-threatening illness or injuries until they can be given full medical care at a hospital. So this is the definition. This means that basic life support can be given by anyone. You need not be a doctor or a medico in order to provide a BLS. BLS can be given by a layman also. जो अनपढ़ है जिसको कुछ नहीं आता वो भी BLS दे सकता है. तो हम लोग तो डॉक्टर बनने जा रहे हैं तो अपने को आना चाहिए कि ना आना चाहिए? आना ही चाहिए. But as of now, if you see the practitioners practicing in periphery, they are not keen or serious most of the time in initiating this BLS, which is wrong. So when you will enter into the field of active medical practice, you must see that you are trained enough and dedicated enough to give BLS whenever it is required. So in what situation we have to give this basic life support? Situation number one, whenever we find that the patient is not responding. The reason can be anything, right? There is a possibility that he is dead. There is no pulse, no respiration. There is a possibility that he simply has a hypoglycemia. In that situation also, the patient will be unresponsive. Patient might have intracerebral bleeding. In that situation also, patient will be unresponsive. But this unresponsiveness is a trigger for us. So first indication is whenever you find that the patient is unresponsive, or he or she has become unresponsive, or the relatives give the history of unresponsiveness, in all this situation, you have to initiate basic life support. Is this clear?
Yes, sir.
Yes,
sir. Right.
Yes, sir.
Yes, sir.
Uh-huh.
Yes, sir.
Once you observe that the patient is not responding, then you have to see whether he or she has a pulse or not. So how do you check your pulse? How do you check your pulse? By putting fingers over
Finger on wrist.
wrist. Yeah. Right. But in BLS we will not be following this.
Pulse
I'll-
oximeter.
No. I'll check you. I'll tell you how to check the pulse. After that, simultaneously, you have to see whether the patient is breathing or not. Right? So in order to see whether the patient is breathing or not, you simply have to look at the chest of a patient, whether the chest is rising or not. Whenever the patient inhales, his chest will rise. And when he or she exhales, it will get compressed. So there is a rise and fall. The chest movement can be seen. Right? So these two things, palpating a pulse and observing a breath, chest rise has to be done at a time simultaneously. Right? Yes.
Yes.
So this is the area where we have to check the pulse of a patient. And you all put your finger over the area which has been shown into the picture. Do it right now. So by doing this, we are examining carotid artery. So everybody of you must be able to feel the pulse
Yes.
at a place, right? है ना? So can you experience or can you tell me that the pulse is of a sound quality? Everybody? Everybody?
Yes,
Yes.
sir.
Yes,
Yes. Yes. So
Yes,
this,
sir. Yes.
yes. So if
Yes,
our
sir.
blood pressure falls to say 80 millimeter of mercury, we may not be able to palpate radial pulse, right? If it further drops, we may not be able to palpate femoral pulse, but carotid can be felt even if the blood pressure is 60 or 70 mmHg. So this is a pulse which we should palpate in emergency situation. Understood?
Yes,
Yes.
sir.
Yes, sir. Yes, sir.
But one thing, caution has to be taken here that you have to palpate the carotid on only one side, not on both sides, because this is important artery and supplies blood to the brain. So if we palpate or compress both the artery at a time, then the blood supply to the brain may get compromised. Got it?
Yes.
Yes. There is a background noise. Someone please mute. Right. So this is a situation or location where the carotid is there in the neck area. So by placing your finger, two fingers, and over how long you have to palpate this artery? Not more than 10 seconds and not less than 5 seconds. How much time you have to give? 5 to 10 seconds. How do you ensure? By counting 5, like 1001, 1002, 1003, 1004, 1005. You need not see a watch in order to measure or count what time has lapsed. Simply you have to count 1001, 1002, 1003, 1004, 1005. इतना आपने बोल दिया कि 5 सेकंड हो जाते हैं, and over that much period you have to palpate this carotid artery, right? Understood? Yes.
Sir.
Now there are situations that carotid artery may be felt. If you are able to palpate carotid artery, that means the patient's heart is beating. His heart is pumping the blood out. That's why you are able to feel that artery. If you don't feel the pulsation of carotid artery, it means that the patient is in a state of a cardiac arrest. उसका heart रुक चुका है, उसका heart blood pump नहीं कर रहा है, इसके कारण हमें carotid artery नहीं लग रही है. So what we will have to do? We will have to begin cardiac massage, and for that we have to be ready with interdigitating our fingers among each other, because now we are about to begin a CPR, cardiopulmonary resuscitation. Now I request all of you to do this interdigitation of your fingers. Done?
Yes, sir.
Yes, sir.
Yes, है ना? So your dominant hand should be down, and above non-dominant hand should be over that dominant hand, and you'll be placing your hand at this place. So this is over the sternum, right? So this is the sternal bone. This is the sternal bone, and this is lower 1/3 of a sternum. And these are nipples. So the line which joins the nipples, toe nipples, you have to locate the area which is situated over lower 1/3 of a sternum, and you have to place your hand in this position. Understood? Yes.
Yes, sir.
Yes, sir.
Yes. Now you have to compress the chest with maximum force. Right? तो हाथ की पोजीशन आपने ले ली, अभी आपको छाती दबानी है. तो देखो इस पिक्चर में छाती दब रही है अच्छे खासी?
Yes.
Yes. So you have to ensure that you compress a chest at least 5 centimeter in depth. कितनी दबानी है नीचे? 5 सेंटीमीटर
centimeter in
ये आपको फुल फोर्स देना पड़ेगा आपकी बॉडी का। अब ये फोर्स देखो, जैसे आप उसको कॉम्प्रेस करोगे उस समय हार्ड कॉम्प्रेस हो रहा है अंदर अपना, और हार्ड कॉम्प्रेस होने के बाद इट विल पंप द ब्लड आउट विच विल बी सप्लाई टू द ब्रेन, राइट? So this will be the position of our chest and heart when we compress it, and after giving a thorough compression or a thorough pressure, we have to release that force completely. So this will be a state of our chest cavity after we release it, and we have to ensure that we allow that chest to recoil completely. तो पूरा दबाए रखना है, दबा के रखने के बाद तुरंत उसको छोड़ देना है। छोड़ देने के बाद क्या होगा, अपना चेस्ट अपने आप ऊपर आ जाएगा, बिकॉज दैट इज द प्रॉपर्टी ऑफ अ चेस्ट, है ना? चेस्ट इज having some sort of elasticity, so once we release that compression, that will automatically get deflated, inflated, right? So air will enter inside और उसके बाद उसका expansion होगा, but we have to ensure that we need not lose our contact. स्किन का कांटेक्ट जो है चेस्ट के साथ हाथ का, वो लूज नहीं होना है, ठीक है? यहाँ पर देखो, हाथ को जोर से दबा के उसने छाती नीचे दबा दी, यहाँ पर क्या किया उसने, प्रेशर को रिलीज किया, लेकिन हाथ छाती से अलग किया क्या उसने? नहीं किया, है ना? तो आपका टच वहां पर चाहिए, राइट? तो व्हाट शुड बी द फ्रीक्वेंसी? द फ्रीक्वेंसी ऑफ दिस शुड बी 100 compressions per minute. How many? 100.
100 compressions per minute.
100 to 120 compressions, at least 100, but not more than 120 compressions. So this is a real picture of our chest or a rib cage, and within that the heart is situated. So where we have to compress, we have to compress in this area. So our compressions must be delivered over this area, and by doing this, we'll be directly compressing the heart. Majority of the force will be exerted on left ventricle. Understood?
Yes, sir.
Now, how we should position ourselves while giving strokes or compression? And so you can see that the angles are clearly depicted in this picture. You have to ensure that your shoulder is directly above the chest of a victim, right? Directly above. It is perpendicular. It is 90 degree, right? And you have to exert the force not from wrist, right? Not from elbow, not from shoulder. The force must be exerted from hip joint, right? So you have to exert the complete force of your body over the chest of a victim or a patient. So this is how the picture will look like. Whenever you position yourself beside the patient, your posture must be in this form. Is this right?
Yes, sir.
Yes. So this was about giving or providing a chest compression. Now we will see how the breaths are to be delivered. So this lady is performing one maneuver procedure, which is called as a head tilt and chin lift. So what she is doing, she is tilting the head up, and she is lifting the chin. So by doing this, what we are doing, we are ensuring that the airway is opened. What comprises airway? Majority of the airway is formed by trachea and bronchus. So if we don't do this maneuver or procedure, then the airway will remain blocked, which we don't want to happen. So in order to open the airway, we will have to lift the head of a patient, tilt the head of a patient and lift the chin so that his airway is opened and we can push the air directly into the lung. So after doing this, we have to pinch the nose of a patient and blow an air from our mouth into the mouth of a victim or a patient. And this we have to do twice. So after giving after giving 30 compressions, chest compression, the rescuer or whoever is providing a basic life support to a patient will give 2 breaths to a patient. How many?
2.
2 breaths. After how many compressions?
30.
30 compressions. है ना? So what is the ratio? What is the ratio now? 30:2. After every 30 compressions, 2 rescue breaths will be delivered. Then again start giving compressions, 30 compressions followed by 2 rescue breaths. 30:2, 30:2. This is a ratio, right?
Yes, sir.
Nearly 4 times now.
Now, if we have our own clinic or we have our own hospital, then probably we will be having this sort of a apparatus or device or instrument, right? So have you ever seen this before?
Yes, it is used on.
Huh?
No, sir. No. No, sir.
Yes, sir.
तो जब आप क्लिनिक डालोगे या हॉस्पिटल डालोगे तब आपको ये खरीदना पड़ेगा, ठीक है? हाँ, इसको बोलते हैं अम्बू, AMBU, एम्बुलेटरी मैनुअल ब्रीदिंग यूनिट, है ना? तो ये 500-600,000 रुपीज का आएगा, लेकिन you must have this in your crash cart or emergency kit, which you will be placing in your OPD also, at your home also, because in emergency you can get call from anybody anywhere. So this AMBU device has a mask. This is called as a mask, or this is a bag, and there is one tubing. There is one tubing here which goes to the oxygen cylinder. तो ऑक्सीजन सिलेंडर को इसको कनेक्ट किया जाता है, यहाँ से ये बैग में ऑक्सीजन आता है और वहां से ये मास्क को हम लोग डिलीवर कर सकते हैं पेशेंट, राइट? Yes. So we have to place this mask over the face of a patient, ensuring that the mask covers nose and mouth both. Are you getting me?
Yes.
Yes. And so
Yes,
we
sir.
have to. So we have to make. We have to fix the mask in such a way that no air is leaking out. So this is called as a C and U method of fixing a mask. So if with this index finger and thumb, he is making a C. समझ रहे ना? पहला वाला C बन रहा नहीं है, and बाकी के 3 उंगलियों से he is making a E. दिख रहा है? He is making an E. So this is called as C and E method of placing a mask. So by doing this, we can ensure that the mask is placed firmly and there is no leakage of air, because we don't want the air to be leaked. Now you can see it is clear in this picture. So which fingers are making C?
Index and thumb.
Index finger.
And rest of the 3 fingers, what they are making? E.
E.
So this is a C and E method of positioning a back mask or AMBU, right? And which hand he is using for doing this? Left.
Left
And
and
with
left
right,
hand.
and with right he'll be, and with
He
right
is using AMBU.
he will be compressing AMBU. You can see that the tubing is attached there, which is going to the oxygen cylinder directly.
Oxygen cylinder.
Right. And at the same time, you can see that he is ensuring that he has tilted head. Right?
Yes, sir.
Background now somewhere. Please unmute. बहुत सारा बच्चों का आवाज आ रहा है पीछे से. Right. So up to this point, is there any doubt? Somebody, if you have, you can ask the question. Okay. So what is this? Can anybody tell?
Algorithm.
No, this is ECG.
ECG.
Electrocardiogram, right? Yeah. So if you have hospital or ECG machine or a monitor with you in your OPD or clinic, then you will have to place the monitor, attach the monitor to a patient, and you can see the rhythm. Now there are 3 rhythms here. The top rhythm is a normal sinus rhythm, normal activity of a heart.
Yes, normal. Yes.
Where the rate is say around 70 or 80 beats per minute. But in the middle finger, you can see that the rate is increased, right? So the rate is around 200 or something. So this is ventricular tachycardia, means the heart is beating very fast. The ventricles are beating very fast. And in the strip which is there shown in the bottom, the rate is even faster. It is around 300, right? So this sort of a picture on a monitor demonstrate that the patient's heart rhythm is not normal, it is abnormal. And in this situation, only giving CPR will not help. You will have to give shock to the patient. आप लोगों ने सुना होगा ना कि हार्ट को शॉक देना पड़ता है, अरेस्ट होता है जब, yes, है ना? So in this situation, we have to deliver a shock to a patient. Without giving a shock, a patient cannot be revived. Right? So you have to have the knowledge of these arrhythmias also, abnormal rhythms also. And for this, the use of defibrillation has to be done. अभी इसमें देखो आप लोग, earlier ECG, the rate was more. Now the rate is low. है ना? The rate is
Yes, this will low.
These are called as a heart block, complete heart block. When this ECG will be there when the patient has a heart rate of a 300. But if someone has a heart rate of a 20 or 30, then this kind of a graph will be seen. And as you will advance in 3rd year or 4th year, maybe you will learn this ECG also. And during that time, you must learn these abnormal cardiac rhythms also, because this will help you determining the course of action in a patient. Now, can you tell me what has happened in this ECG? Initially, the rate was high, and then the heart
Low.
zero. So this was a ventricular fibrillation. This is called as a VF, and which has led to cardiac arrest. So at this point, the patient has died. And so this is a flat line, which is called as asystole. Asystole, absence of a systole. Absence of a systole. So at this point, you have to begin the CPR, or this is when you need to start the CPR. What are components of CPR? So we have to start compression within 10 seconds of recognition of cardiac arrest, right? 10 seconds of recognition of cardiac arrest. Now, how would you recognize cardiac arrest?
By placing the hand over.
No, first checking the consciousness. No, checking the consciousness.
Observing chest, observing.
So now first observing the responsiveness.
Yes.
Second, by placing 2 fingers over carotid and observing the chest rise simultaneously. Right?
Yes.
Once we see that there is no pulse and no breathing, what next? We have to begin the compression. At a rate of
10 seconds.
at a rate of
100
within
a minute.
100 to 120 compressions per minute. Right? And how
More than
and
120.
not more than 120. And how deep we have to compress?
5
5
centimeters.
centimeters.
Centimeter.
5 centimeters. Right. And we will have to allow the chest to recoil completely. बरोबर, हमने एक बार कॉम्प्रेस करने के बाद वो चेस्ट अपने आप ऊपर आएगी, तो कंप्लीट ऊपर आने देना है उसे. Then what next? You are going to give 2 breaths after 30 compressions.
Yes.
Right. So at that point we will be stopping the compressions. उतनी देर के लिए compression बंद हो जाएगी ना. So there should not be delay in restarting the compression. Right. So you have to ensure that you finish giving a rescue breath within 10 seconds. So this is called as a minimizing interruption. So you have to see that you minimize the interruptions between 2 set of compressions. Means you should not spend more than 10 minutes in giving rescue breaths. How many rescue breaths we are supposed to give after 30 compressions?
There are
Two.
Two breaths. Right. Now how many breaths has to be given? 2. How much air has to be delivered? The air delivery should be just enough to ensure that the chest is rising. छाती में हवा कितनी भरनी है, उतनी ही जब हमें
जब तक चेस्ट ऊपर नहीं
छाती फूल रही है. समझ रहे हैं? ज्यादा हवा भरेंगे तो क्या होगा? ज्यादा हवा अपन अगर भरेंगे तो उसकी हवा लंग से या ट्रकिया से निकल के स्टमक में चली जाएगी, उसका स्टमक फूल जाएगा, है ना, एब्डोमिनल डिस्टेंशन हो जाएगा और वो डायफ्राम को कंप्रेस करेगा, फिर चेस्ट की एक्सपांशन को लिमिट करेगा. नंबर 1. नंबर 2, अगर हम लोग फोर्सफुली ज्यादा हवा देते हैं पेशेंट को तो उसका अल्वियोलाई फूट जाएगा अंदर से. Alveolus like balloon, no? So that is not good. We don't want to rupture that alveolus, है ना? So हमेशा जब हम लोग अम्बू करते हैं या माउथ टू माउथ ब्रीथिंग देते हैं तो हमें ये देखना है कि हम लोग ज्यादा हवा नहीं भरेंगे. आप लोग बलून में ज्यादा हवा भरेंगे तो क्या हो जाएगा? वही सिचुएशन लंग्स में भी होती है, क्योंकि लंग्स भी बलून ही है ना, लंग ही एक प्रकार का बलून ही है ना. तो हम लोग उसमें अगर ज्यादा हवा देंगे तो that is not good, that is not helpful. Ulta, it will damage a patient, it will cause harm to a patient. Understood?
Yes.
So can you all revise this now? Read first line.
Start compression within 10 seconds.
Be loud.
Compression rate 100 to 120 per minute. Depth at least 5
centimeter.
On
Or
the
one-third depth of chest.
Next.
Allow complete chest oil.
Next.
Interruptions limit to less than 10 seconds.
Give effective breath.
That make the chest
And last and most
ventilation.
right? Yes. Yes. So what is a compression ratio? Compression ratio is compression to 30. The depth of a compression should be 5 centimeter in adults.
5 centimeters.
If the victim or patient is infant, then that should not be more than 4 centimeter.
4 centimeters. Yes.
Right. Head tilt and chin lifts. That maneuver we have to do before giving rescue breath. EC clamp technique you all understood? What is E and what is C?
Yes, sir.
Thumb and index finger form C and remaining fingers form E, right? And one breath over 1 second. So 2 breaths over 2 seconds.
2 seconds.
Yes. Now there can be situation when a patient can have only respiratory arrest, है ना, कि आपने देखा उसकी छाती तो फूल नहीं रही है लेकिन उसकी पल्स है. This can happen, no?
Yes.
So what would you do then? तो उस सिचुएशन में आपको चेस्ट कॉम्प्रेशन तो देना नहीं है क्योंकि उसका पल्स है, उसका हार्ट चालू है. तो इस सिचुएशन में हमें क्या करना है, केवल ब्रेथ्स देने हैं उसको। अब पहले क्या कर रहे थे हम लोग, 30 कॉम्प्रेशंस के बाद 2 ब्रेथ दे रहे थे, लेकिन यहाँ पर हमें कॉम्प्रेशन देने की जरूरत नहीं है, हमें केवल रेस्पिरेशन देना है। So in that situation the ratio will change. What we will be doing then, we will be giving only breaths every 5 to 6 seconds. If we give one breath over 5 seconds, how many breaths will be there in 1 minute?
10 to 12.
12 breath per minute.
Which is equal to our normal respiratory rate. है ना? If the patient is a child or infant, then the frequency of giving breath would vary. It would be every 3 to 5 seconds. This means that we'll be delivering almost 20 breaths per minute when the patient is an infant. So ये किस situation में करना है हमें? Only breath का?
Respiratory arrest है और respiration नहीं है.
Condition.
Only respiratory arrest, है ना? और जब भी हमें लगता है कि पल्स है लेकिन उसका रेट is less than 60 and patient is not responding, in that situation also you have to start CPR, right? Because even though a patient is having pulse, but that is not enough to induce or generate strong cardiac contractions. क्या हो रहा है उसमें, पेशेंट का कार्डियक आउटपुट या स्ट्रोक आउटपुट जनरेट ही नहीं हो रहा है, पल्स तो है लेकिन वो वीक है ना? तो इसलिए उस सिचुएशन में भी we will have to begin CPR. Got it?
Yes sir.
Yes.
Yes, sir.
Yes. लेकिन अभी एक सिचुएशन है कि जहां पर पेशेंट आपके पास आया और उसने एंडोसल्फान लिया है या पॉइजन लिया है और अनकॉन्शियस है वो, तो would you start doing CPR and giving rescue breath? No.
No.
Because that can cause harm to you.
Because
बरोबर
air will
है?
react with that air.
है ना? अगर आपके घर में कोई इलेक्ट्रिशियन आया और उसको करंट लग के वो नीचे गिर गया काम करते करते, तो would you begin CPR there?
No.
Why? Why? Because he has been electrocuted. अगर आप उसको छूओगे तो आपको भी शॉक लग जाएगा, right? That means in this situation the scene is not safe. So before beginning CPR, before providing basic life support, you have to ensure that the scene is safe. So this is first and foremost requirement, and that is called as a verifying scene safety, right? If somebody is lying in the middle of a road and there is heavy traffic, you are not supposed to begin CPR there or give BLS there. कहीं आग लगी है, flood आया है, in that situation first of all you have to ensure that you are safe, then only you can begin CPR. Understood?
Yes.
Yes. Yes, sir.
Yes sir.
Now this is how the pulse has to be checked in infant. Infant मतलब ऐसा बच्चा जिसकी उम्र 1 साल के नीचे है, बराबर? So is the doctor checking carotid in this case? No.
No.
He is checking brachial pulse. So can you all check your brachial right now by placing your fingers at a position where the doctor has placed? It is difficult to locate, but you still try to locate. Let me know if you are able to locate it.
Yes sir.
Yes.
Yes,
So
sir.
this is a brachial pulse, huh? So in infants, we are not supposed to check the carotid. Which pulse we are supposed to check? Or we should check the
Brachial.
brachial pulse, right? And for the purposes of definition of a cardiac arrest, absence of pulse was a requirement in adult. But in children, if the pulse rate is less than 60, that is considered as a cardiac arrest. Are you getting me? So what is the difference? Even if there is a bradycardia, the pulse is below 60 and patient is not responding, that infant is not responding, it is considered as a cardiac arrest.
Cardiac arrest.
समझ रहे? बच्चों के लिए। अब इसमें अपन पूरी की पूरी छाती दबानी है हमें, तो बड़ों के जैसी नहीं दबाएंगे क्योंकि बच्चे नाजुक है। So these are the methods of giving chest compressions. So this method is used when the rescuer is a single. यदि आप अकेले हो तो what you would do? You would put your two fingers together and will locate the lower 1/3 part of a sternum and will start compressing a chest of an infant. Got it? And if there are two rescuers, so what you will do? You will encircle the chest of an infant, and by putting your both the hands together as shown in the picture, and you will start compressing using both of your thumbs. Right? So which method will be delivering effective compressions? This second method. This will also be effective, but this will be more effective because we will be able to compress the whole chest. वो बच्चा छोटा रहता है उसकी पूरी की पूरी चेस्ट अपने हाथ में आ जाती है, तो अपन उसको चारों तरफ से दबा सकते हैं उसको. Understood?
Yes, sir.
Yes, sir. Yes, sir.
So we should. अभी आप करोगे कि नहीं? अगर कोई अरेस्ट हो गया पेशेंट आपके पास, पड़ोस में कॉल आ गया तो कर पाओगे ना?
Yes, sir.
Yes, sir.
ग्राउंड में, मैदान में कोई गिर जाता है खेलते खेलते, स्विमिंग पूल पे कोई अरेस्ट हो जाता है, बस में, रेलवे स्टेशन पे, एयरपोर्ट पे कोई अरेस्ट हो जाता है, समझ रहे? तो ये दिस इज something which is necessary, which everybody, not only medical practitioners but all the people in the society must get trained on this method of providing basic life support to a patient. So if you have any questions, you are free to ask. And if you come, after you come to a college, we will have a live demonstration of all this process. So Kulkarni madam, I am done. If students have any questions, they can ask.
Yes.
Poonam.
Student can ask student questions if they want.
अराफत अली है क्या यहाँ पर? अरफात अली, yes. And so what is the compression ratio?
30:2.
अराफत ही बोलेगा केवल. हाँ,
30:2.
30:2.
Yes.
बरोबर. 30. So भूषण ठाकरे. भूषण अथर्व भंडारकर. अथर्व, चेस्ट कितना दबाना है नीचे?
100.
नहीं, कितना दबाना है? What should be the depth of the chest compression?
सर एडल्ट में 5 सेंटीमीटर और इन्फेंट हो तो 4 सेंटीमीटर.
Good, excellent. दीप्ति त्रिपाठी. मैडम, बहुत सारे स्टूडेंट मतलब लॉग इन हुए लेकिन उनका जगह पे नहीं है वो लोग. दीप्ति पाटिल.
Yes, sir.
Yes. What is a protocol if the patient has pulse but no respiration?
Respiratory rescue.
So what is the protocol? After how much time we give AMBU ventilation? And how many AMBU ventilations are to be given in 1 minute?
10.
Yes.
10.
10 ventilations in 1 minute. After how much time? 5 to 6 seconds. After 5 to 6 seconds.
6 seconds.
Right? Yes. Kajal Yadav. गुंजन मेश्राम.
Yes, sir.
बच्चों में पल्स कैसे पल्पेट करते हैं?
So first we check the brachial artery and
Yes, sir.
Right.
Yes, sir.
Who is this? Right. Okay, no problem. So I think majority of the students were attentive and they could answer almost all the questions which I have asked. So from my end, that's all, ma'am. And if students don't have any questions, the session can be concluded.
हेलो,
Yes,
प्रिंसिपल सर को पूछना पड़ेगा सर.
means
Sir, I have a question.
yes, go ahead.
Sir, whenever we have to check the brachial artery, should we check on the right side, right hand?
Any arm.
Okay.
Any arm. When if you are not able to locate it on the first arm which you touched, you can go for locating it on a second arm, but you should not waste more than 10 seconds in doing that.
Okay.
Right?
Okay.
And if you are in suspicion that the artery is there or not, the pulse is there or not, consider it as it is not there.
Okay.
Right? Even if it is there, but if the patient is unresponsive, you can begin CPR.
Okay. Thank you, sir.
So I have a question.
Huh?
So when we give CPR to infant, so then if in a case of single rescuer, which hand should we use?
No, in case of single rescuer, thumb should not be used at all.
So
In case of in case of a single rescuer, we have to use two fingers, middle finger and index finger. I'll show you the picture. Just a moment. This.
so of which hand, right or left?
Dominant hand. Dominant hand. If you are a righty, then right hand, and if you are lefty, then left hand.
So, but why should we use our dominant hand?
And because with that we can exert maximum force, we can give high quality CPR. Try doing it with a non-dominant hand, you will develop fatigue easily. And if we become fatigued, the force of contraction will be, the force of compression will be compromised, and the effective quality of CPR will not be delivered. CPR आप करके देखो, 1 मिनट में वाट लग जाती है, बहुत ताकत लगती है उसको.
Thank you, sir.
कुछ क्वेश्चंस है क्या? किसी को पूछने हैं क्वेश्चंस? Any doubts?
It was a wonderful lecture as usual, and hopefully sir will demonstrate it offline, physically on the mannequins.
Yes, sir. Yes.
Students will enjoy further. And good part of the lecture is that our Dr. Pradesi was able to generate the interest in the students. And I could see that students were asking questions, and in none of the sessions they asked any question up till now. So it is, as I told in the beginning, Purva Abhibashi, he had made the students to ask the questions. It's a good thing. So we can conclude the session now for today.
Thank you.
Veena madam, it's up to you.
Thank you, sir. Pardeshi sir. Resuscitation के बारे में आपने जो प्रैक्टिकल नॉलेज दिया है स्टूडेंट को, वो बहुत ही इंटरैक्टिव सेशन था, अट्रैक्टिव सेशन हुआ है. स्टूडेंट्स बहुत अट्रैक्टिव थे आपके पास, और बहुत ही इंफॉर्मेटिव, कलेक्टिव, नॉलेजेबल सेशन था. थैंक यू सर.
Thank you, ma'am. Thank you all students for listening. And whenever we will meet face to face, then we will again discuss if you have any questions. Right?
Yes, sir.
Yes, sir. Thank you, sir.
Thank you, sir.
Yes, sir. Thank you, sir.
ये सेशन आज कंप्लीट हुआ है. कल टाइम टेबल के हिसाब से मिलेंगे. थैंक यू वेरी मच. थैंक यू.
Thank you, ma'am. Thank you, sir.
Thank you, ma'am.
And thank you, Veena madam.
Thank you, sir.
For answering the session.
Thank you, sir. Have a nice day, everyone.
सेशन नहीं है.
नहीं, इसके बाद ही है बेटा. आज का कंप्लीट हुआ है, कल होगा सुबह.
Okay. ठीक है मैम,
शुभदिनः
Thank you,
सर्वेभ्यः
ma'am.
शुभदिनः